I like molecules. I like making new molecules, but with purposes, to treat disease. And a lot of the work that we do lately has sort of turned more towards proteins because they're arguably the fastest growing class of pharmaceuticals. About 10 years ago, we started developing this approach where we could control the release of insulin and other hormones like it continuously, variably, but without a physical pump. But instead, we create a kind of insulin that you inject into the skin, just like you would normal insulin, but that you stimulate through the skin with a very small LED light source, maybe the size of a nickel, that you can put on top of it on the skin. And that pulses of LED light go through the skin and stimulate the material to release insulin. So more light means more insulin. So the idea is you get all that continuous variability that you would get from a pump, but without the physical connection. And we started applying it to other hormones, things like glucagon. We thought, is it possible that these groups that we're attaching to control glucagon with light, maybe they would prevent the association of the glucagon just through a variety of different mechanisms. And so we tested it and we found, in fact, it did. It was very effective at preventing the glucagons from self-associating. But we're now applying to other proteins as well, these modifications that prevent self-association. Turns out it's a huge problem in the area of protein pharmaceuticals. The potential of the technology is to take the administration of these drugs out of the hospitals and into a home setting where a nurse could do it or a patient can do it. It's kind of an enabling technology that could be added on to not just the existing protein drugs, but any protein drug that comes along. It's exciting to try to target a disease and treat a disease, but to develop something that potentially could be used for dozens of different applications, and that's I think what I'm scientists in general, at least I am trying to do, is have the most impact for the hours that I have, and so the potential broadness of the applicability of this approach is something that really appeals to me.